Hi guys, it's Dr. Tlaleng again, and today we're going to discuss menstruation and what it does and what the purpose of it is. Firstly, your menstruation, it's called a cycle because it is a cycle. It happens, predictably every month. Everyone has a period if you're not on a contraceptive. And the importance of this is that every month, if you do not fall pregnant, the uterus and the lining inside the uterus will then shed, and that's what we see as the blood and then the menstrual cycle. What's important to remember is that everyone is different and not every woman will react in the same way to the menstruation, and you may have some irregularities every now and then. If that happens, you have to consult with your doctor or your nurse just to find out more details about what's happening. And just to give you an example, some of the things that may be irregular or abnormal is if your period is very short. We know that a normal period should be anything between 3 to 5 days, even 7 days is okay. And if it's too long, for example, and you find yourself that you're bleeding now for more than 2 weeks, even 3 weeks at a time, that would be something that you can be concerned about. Another thing is if your period is suddenly very heavy and you're not used to it being so heavy, that could be a cause for concern as well. And another thing is if you've got pain that's suddenly worse than what you normally have with your period, that is something that you may need to consult and find out if there's anything that you need to worry about. And when it comes to menstruation, we know that there are options for the products that you can use. There's sanitary pads, there's tampons, there's things called the Diva cups, which are not really available as readily. But today I will show you how the different types of the tampons and how the sanitary towels also work, and all the the advantages and the disadvantages of each. Just going back to the cycle quickly, I've got something to show you just to illustrate what a menstrual cycle looks like. So if you look here on the green, right, these days represent the time that you're actually having a menstrual bleed and the uterus lining is shedding. And in phase 2, that's when your uterus lining gets thickened again and the egg starts to mature. In the third phase, you have ovulation. This is when the egg gets released. This is your fertile period. This is when you have the highest chance of falling pregnant. The next phase, which is the fourth phase, that's when your egg travels in the uterus. This is when the lining of the uterus continues to thicken. If pregnancy doesn't occur in any of these days, then you will enter into phase 1 again, where you will then have the uterus of the lining shedding and the blood flow starts to happen. So I'm just going to show you now how a sanitary towel works quickly. These come in different sizes. Some have wings, some don't, and depending on how heavy your flow is, you may choose to buy a thinner sanitary pad. And basically this one that I have has wings, so you would need to be wearing panties when you use sanitary pads, and you can clip that and make sure that it stays in place. And just to show you the absorption of how the menstrual blood would work. All right. Okay. So that's how your sanitary pad works. All right. The blood is collected here, it's absorbed, and you just need to remember to change this every 4 hours or so. If you find that perhaps using a lighter sanitary pad and your flow is a bit heavy, then you just have to change the tampon, the sanitary pad, within the 4 hours. So that, that's what it looks like. All right, the next option is tampons. Tampons are great because you can go swimming, you can play sport, while you have these. And they also come, just like the sanitary towels, different sizes, and you go for light, medium, and these ones are for a very heavy flow. As you can see, they're quite thick. And the same way, you would slide this into the vagina. And I'm just going to simulate for you quickly how this absorption would work. All right. And that's how a tampon, it then expands as it absorbs the blood inside the vagina. And what you would then have to do is, with the string, will just be like this outside of your vagina. And to remove it, you simply just slide that out and you wrap it away in a tissue and you throw it off. And what we need to remember for both of these options is that they are safe, they're accessible, and you just have to choose an option that is comfortable for you.